Good morning, everyone. Today I'm going to tell about GORD, which is called gastroesophageal reflux disease. Now, in plain words, what it means is, as we all know, that stomach contains gastric acid. But sometimes it so happens this acid regurgitates into the esophagus, which is the food pipe. As a result, there is extreme pain felt in the esophagus, and also the patient gets heartburn as a result of it. This condition occurs when the valve between the food pipe and the stomach gets laxed. As a result, the acid quickly moves into the gullet. It occurs mainly when the person is lying down, but also it can happen when someone is stooping down to pick up something. Normally, the esophagus and the stomach has got a sphincter which keeps this junction closed, and it only opens when someone is eating something or drinking something. But sometimes, because of some reasons, this sphincter becomes loose. It occurs mainly in overweight patients, and also it occurs in a condition called hiatus hernia, when the stomach slides to the diaphragm, thereby the sphincter becomes weak. When this condition occurs, the patients become symptomatic. They get chest pain. Sometimes people are confused whether this pain is coming from heart or not. Obviously, when there is a confusion, there should be investigations done to rule out any coronary artery insufficiency, or in other words, when there is any heart disease. But to prevent or treat GORD, we need to use a few agents. For instance, proton pump inhibitors are very good agents to reduce the gastric acid output, thereby to some extent reduce the symptoms of gastroesophageal reflux disease. Sometimes we also use antacids and a product called sucralfate. In patients having overweight or obesity, the treatment of choice obviously are those agents that I mentioned, but it's also extremely important that they reduce weight. Sometimes, if there is the condition that I mentioned called hiatus hernia, whereby the stomach slips through the diaphragm, there can be operations done to rectify this slip of stomach into the chest, or what is called when someone has got hiatus hernia, what happens is the stomach slides to the diaphragm. Now, this process can be cured by surgical intervention. In a way, if the surgical intervention is done, then the reflux symptoms can be avoided. So, why should we be worried about gastroesophageal reflux disease? Obviously, if someone's acid continuously pours from the stomach into the lower end of the esophagus, which is the food pipe, then what it causes is not only you get symptoms of heartburn and pain, but it can also change the mucosal layer of the food pipe. What I mean by mucosal layer is the lower end of the food pipe or the esophagus has got some mucus lying on it, and there are some epithelial layers beneath that. Because of this continuous pouring of acid into the lower end of the esophagus, this cell structure can get changed. We call this condition as Barrett's esophagus. The problem is, if there is continuous acid pouring into the esophagus, sometimes the Barrett's esophagus can also get converted into cancer. So that is the reason gastroesophageal reflux disease is something which should not be ignored, and treatment should be started at the very onset. Obviously, the other thing that we need to do is to diagnose whether it's really gastroesophageal reflux disease, because sometimes we empirically treat people for this condition without excluding other vital problems like coronary heart disease. So, it's important that if someone has got suspicion of gastroesophageal reflux disease, he or she be referred to a gastroenterologist. They should be doing proper endoscopic examination, and if the disease is confirmed, then treatment should be started as quickly as possible. Lastly, it's also important that we should have some sort of preventive measures to prevent the symptoms of heartburn. For instance, people should avoid fasting for a prolonged period, should avoid taking too much of spicy food, should avoid also taking excess tea, coffee and cold drinks. And also, the patient should not be eating too much at one go, which means that your volume of food in the stomach should not be too much.